Focal therapy is an image-guided treatment for prostate cancer, which includes treatment of the cancer itself plus a safety margin of normal tissue. It's sometimes used interchangeably with the term partial gland ablation, which is destruction of prostate tissue using an energy source to just part of the prostate. High-intensity focused ultrasound is an ablative energy modality that can be used to treat various tissue types. We use it in prostate cancer to be able to destroy prostate tissue through the use of heat. So it takes high-frequency, high-energy ultrasound waves or sound waves that are focused to a very specific point and delivered very precisely to small areas of the prostate, which are subsequently overlapped to create a confluent ablation zone or confluent area of tissue that's destroyed. High-intensity focused ultrasound, or HIFU, is one ablative energy modality that we use for prostate tissue or prostate cancer ablation. It is one of many different tools in our toolbox, and those other tools include irreversible electroporation, laser ablation, microwave ablation, radiofrequency ablation, which is a short list of many different technologies that are available in this space. HIFU really excels in tumors that are closest to the ultrasound treatment transducer or in the posterior prostate, and also for smaller prostates. It is a minimally invasive tool that does not require the use of any surgical incisions or cuts. The ideal patient for HIFU in prostate cancer is an individual who has intermediate risk prostate cancer or Gleason 7 prostate cancer, that it can be seen on some sort of imaging modality, either prostate MRI or prostate-specific membrane antigen PET scan, and it is targeted with a fusion biopsy to confirm its exact location, and that it's isolated from vital structures that we want to preserve, and it is within reach of whichever tool that we use, in this case, HIFU, that it would be in the posterior aspect of the prostate, ideally. The recovery after HIFU is actually very different compared to standard of care treatment options such as surgery or radiation. For almost all patients, it is an outpatient procedure, which means that they go home the same day. They do typically have a catheter in place for about 3 to 5 days that does cause some minimal discomfort. But after the catheter is removed, most all patients can return to their normal activities similar to what they were doing prior to the procedure. Some men will have some irritative urinary symptoms like urinary frequency, urgency, pain or burning when they urinate, or blood in the urine that generally lasts about 1 to 2 weeks. The risk of urinary leakage with HIFU is virtually zero, and the large proportion of men who have good baseline sexual function will return to close to their baseline sexual function within about 3 to 6 months. Now, when we compare that to surgery or radiation, many other patients will be exposed to the risks of urinary leakage, bowel-related symptoms, increase in urinary symptoms, or hormonal symptoms that can be associated with the use of androgen deprivation therapy that is combined with radiation treatments. Pain after HIFU is actually quite minimal. After the initial discomfort with a catheter, most men do not require any pain medications even immediately after the procedure. After any treatment for prostate cancer, we'll need to continue to monitor that individual to ensure that the cancer does not return. In HIFU or in focal therapy, it's important not to just look for areas which were previously treated, but in this unique scenario, there's areas of the prostate that have not been treated and can develop new prostate cancers. The follow-up after HIFU or any focal therapy is really based on 3 critical cornerstones, and that is going to be PSA, or prostate-specific antigen testing, prostate MRI or imaging, and also biopsy initially to confirm success of the ablative treatment. The cancer control rates for HIFU are actually quite promising. When we look at treatment success rates in 5 years following HIFU, they range from 50 to 85+%. When we compare that to the standard of care, radiation or surgery, in the context of intermediate risk prostate cancer or Gleason 7 prostate cancers, those success rates range from 80 to 90+%. However, this can come at the expense of quality of life. Now, when we're choosing HIFU for treatment, we want to again make sure that we're choosing the right patient for the right treatment. If a cancer recurrence is experienced after HIFU, we still, in many cases, have all treatment options that are available to us. A repeat ablation is possible as long as they meet the original criteria that you set, and it remains isolated from vital structures with the ability to preserve quality of life. It's important to note, though, that after any initial treatment, secondary treatments can be more challenging and have different cancer control rates.